The global economy reeling from the impact of the coronavirus. And in an emergency move today, the United States Federal Reserve cut interest rates, making it cheaper to borrow money for cars, homes, and business loans. Italy, which is on the brink of a recession, is the epicenter of the outbreak in Europe. Today, Italian officials said the number of deaths now stands at 79. That is double since yesterday. Most cases are in the industrial region of Lombardy, where schools have been closed for over a week. Here in the United States, there have been at least 9 deaths from the coronavirus, all in the Seattle region. The House of Representatives is set to vote on billions to combat the outbreak later this week. Joining me now from Rhode Island to talk about the coronavirus from both a medical and a Catholic perspective is Dr. Timothy Flanagan. He is a professor of medicine at Brown University, infectious disease specialist at the Miriam and Rhode Island hospitals, and a Catholic deacon. Dr. Flanagan, welcome to the show. Thanks for joining us. So the coronavirus has infected more than 90,000 people worldwide and killed more than 3,100. As an infectious disease specialist, should we be concerned?
Sure. This is a very difficult, terrible new infection, and it's spread like many other respiratory infections, similar to flu, and you can think about it in that same way. And flu has obviously caused many more infections and many more deaths, but this is new. And so we are struggling to meet the challenges of it carefully, and it's difficult and very, very tough.
What precautions should people be taking at this point?
We have a good idea of how this is spread. It's spread through droplets through the mucous membranes. And that means hand washing, using alcohol-based hand sanitizers, not touching our mouths, not shaking hands the way we do. This is a time where you might want to touch your elbow and keep a little bit of a distance. But it doesn't mean that life should stop. We need to keep calm and carry on. But each of us can make a real difference in the spread of this infection. We've seen this with other infections. If you're ill, meaning a fever or a cough, or you've got a terrible cold and your nose is running all the time, that's a good time to stay at home.
Yeah, well, this certainly leads me to my next question. The virus has changed the way that a lot of us live our daily lives,
Yes.
and in fact, including Mass as well. A lot of people are not, shaking hands for the sign of peace. They're just kind of nodding and at communion as well. What's your advice for Catholics during this time?
Well, the sacraments and the Mass is so critical for us. It's really the center of our faith, and Jesus is present. So being able to receive communion and the other sacraments, confession, and even the sacrament of the sick is so, so important, and it can be done safely. But this is a time where we want to forgo shaking of hands, as you say, at the sign of peace, but we need to smile double and show our support and our welcoming attitude. We should be receiving communion, but it can be done with communion on the hand with minimal contact in that regard. Certainly confession, totally safe, and the other sacraments can be done. So even the oils can be applied with a cotton ball. So there are ways to do this safely, and our churches need to stay open. We need to help each other, but we also need to strengthen our faith, our prayer life, and we need to worship together. And this is possible. We should avoid a lot of crowding. So all being crammed together is not good. But most of our churches, we're not jammed together. There's plenty of room in the pews, so we can go to church and Mass safely.
All right. Well, wonderful. Thank you so much for your time, Doctor. We really appreciate it. Dr. Timothy Flanagan, thanks again for your insight.
Happy to help.